We are the Desmond Tutu Health Foundation, and we are affiliated to the Desmond Tutu HIV Centre, an accredited research centre within the University of Cape Town. So today is our annual LGBTQI Health Day, and we're very proud to engage with relevant stakeholders and really cement this day. It's close to World AIDS Day, and you know, it's an important day on our calendar. The purpose of today really is to shine a light on populations who, because of lifestyle, because of who they are, because they are often disaffected and marginalized, are at increased risk of HIV acquisition. But actually, because of structural reasons, ideology, prejudice, a whole variety of reasons, they actually don't receive optimal services, and we won't end the HIV epidemic if we don't address that. So today is about shining a light on LGBTQI communities in particular.
And I think it's quite troubling that our advocacy, don't have...
I mean, I heard how we get persecuted, how people still discriminate. I mean, it's institutionalized homophobia that we're dealing with. It's really being cut out of the health sector because you identify as whatever. So don't see me as an outsider, see me as part of a community, and let's use these tools to really spruce up our education, because that's important.
As a medical doctor, I feel that we have received inadequate training in being approachable to gender diverse populations. I feel that HIV is now more of a social issue rather than a medical one. We have adequate treatment, we have great treatment, and we have the best treatment program in the entire world. So why do we still have high incidence and high prevalence of HIV? Why are young women and adolescent girls still stigmatized?
That speaks to the kind of sex that's engaged.
You need an engaged leadership. So every healthcare service needs to have leadership expressing support and nominating a team to make sure that their healthcare environment is inclusive and welcoming to the LGBT population. The second thing is visibility. So there needs to be visibility. People coming into that healthcare environment need to know that it is a welcoming environment. The staff also need to know that it is a welcoming environment, so that there's a general sense created in that environment that allows people to be comfortable expressing their diversity. And I think the third thing that is important is that the needs of the community are cared for. And there are some very basic needs, for instance, pre-exposure prophylaxis PrEP for men who have sex with men and transgender women is vitally important. It should be available in our clinics, in our healthcare environment. Gender-affirming hormones are very important and should be widely available for transgender people accessing care.
Days like these, health research days, which include non-governmental organizations, the National Department of Health, clinics, clinicians, psychologists, social workers, a vast array of people who have a common shared interest in promoting the rights and health promotion, really, of gender diverse individuals. This is an important step to take what we learned today and our efforts to the ground, to grassroots level, to promote the safety and well-being of gender diverse populations.
You know, I think it does require us to come at this saying, what is the differentiated service delivery model that we want to provide? And that says, who is the who? What is the what? Where are we doing this, and how are we doing this in order to make sure that all individuals across the board, regardless of their sexual orientation or their gender identity, are able to be accommodated within our health services. But we also want to be sure that, this is not only an annual event, but that these conversations go on throughout the year.